first up, we are looking at the incidence of diphtheria in the national capital. The situation is quite acute. It's one particular municipal hospital which has seen as many as 18 deaths in the national capital within a period of 17 days due to non-availability of the antitoxin serum in this hospital.
Now, meanwhile, the North Delhi Mayor Adesh Gupta has set up a panel to look into the deaths and sort a report within 3 days.
Well, so those are the pictures, viewers, coming to you from the national capital. It seems now that the death toll continues to be on the rise. It has reached 18 after 4 more succumbed to the disease. And we are given to understand that the death toll is rising also because of the non-availability of the precise drug that is required to treat this bacterial disease.
And, that's the question that must be asked the government. What is their preparedness of the civic authorities? Because this is a municipal hospital and therefore the blame directly lies on the shoulders of the municipal corporation. If they know that they're short of the serum, what have they done on their part to try and ensure that they actually are able to procure enough? Because we're seeing the cases of diphtheria, in fact, going up. The death toll has gone up. But what about the preparedness of this hospital? Do they not know that they need to have the serum in stock to be able to battle this disease in the capital?
It's an infectious disease, which means it can spread, and therefore there has to be a sense of urgency now to immediately make the treatment available, because it could, of course, rise further, and it seems, like Viren said, a complete lack of preparedness. Diphtheria affects the throat. It produces toxins in the body. It's a bacterial infection that is afflicting children in particular. 18 deaths in 17 days in Delhi.
Dr. Sanjeev Baggai is now joining us on the phone line. Dr. Baggai, thanks so much for speaking to us this morning. This is a bit of an acute problem that we see in the national capital, and it really raises serious questions that if this is the case in the national capital, what about smaller parts of this country where healthcare isn't the best, where the situation is not necessarily, where hospitals are not the best prepared? What chance do they have of fighting the disease if a hospital in the capital of our country is running out of the serum to battle the disease?
Yeah, good morning. I think we'll answer this question in 2 parts. One is, of course, the acute treatment in terms of the therapy which is given to children with diphtheria or suspected diphtheria. It really is a case of very quick diagnosis, early intervention, getting the cultures and the probe correct very quickly, and treating the child. In terms of treatment, of course, we have oral and IV medicines, and then, of course, the diphtheria antitoxin. But more important than that is to screen the close contact, because diphtheria is highly contagious.
Yes.
So whoever the child or the family members have come in contact with, that's the basis of what we say as quarantine or surveillance. So I think we need to contain it.
Right.
It is containable, but we need to isolate the case, that's one, and see what the close contacts in the last 5 to 7 days of that child has been.
So you are saying, Dr. Baggai, that the immediate challenge is to restrict the disease, and is enough being done towards that end? Is enough awareness being created? It's a highly infectious disease, and on top of that, you are running short of the treatment drug. So this is a rather serious situation.
Yeah, I think the facilities are sufficient to contain. We also need to screen how many of these families and children have come from out of Delhi, because the origin of the disease may be outside Delhi NCR.
Okay.
But having said that, we need to quarantine, we need to isolate, and we need to screen the close contact. And early intervention and treatment. And if we treat early, these kids do well. We can recover.
Right. Sanjeev Baggai, many thanks. Dr. Sanjeev Baggai, thanks for joining us this morning. My colleague Milan Sharma is also live with us. Milan, from what we hear, the problem is getting acute also because the hospital is running short of the antitoxin serum. And we just spoke to Dr. Baggai, who tells us it's a highly infectious disease. It is contagious. It's spreading fast. Is enough being done by the authorities in Delhi, by the Delhi government, to restrict the problem and also to make sure that the drug is made available to those who are suffering from diphtheria?
Well, case, in fact, we just did another check inside the Maharishi Valmiki Infectious Diseases Hospital. At this point of time, we were informed by the North Municipal Corporation, under which the hospital is governed, that 200 units of the serum was transported from Kasauli in Himachal Pradesh to the hospital, and there are about 46 more patients inside who are right now being administered this medication. Although when we spoke to the patients, they have said that in many cases the vaccination of these children was not done for diphtheria in their areas. Many of the cases, let me just point out, are from areas of western UP as well, some from Muzaffarnagar, others from Meerut, as well as most cases from Aligarh as well, we are getting to see. And since Saturday onwards till today, in fact, we were reporting how 14 deaths had occurred because of lack of the serum, and now the toll has gone up to 18. So 4 more children have died in the last 2 days that the medicines were supposed to be procured and brought into this hospital by the North Municipal Corporation. Afrida, also a high-level probe has been ordered into the lapses that led to these many deaths in the hospital and why the serum was not available. We had also spoken to the Indian Center Research Institute head, who had said that their laboratory was in renovation at that point of time. They also clarified that the serums were ready for the last 15 days, and yet the municipal corporation had not got these medicines transported to Delhi at a time where the spread of diphtheria is quite evident in cases coming from outside to this hospital, which has led to the lives of 18 children being lost here. Back to you.
But that's a very serious charge made by the manufacturers of the serum, Milan, because if they say that it was made and the municipal corporation failed in picking that drug up and having it brought to their hospitals in the capital, that talks of a serious lapse. What more are they going to do aside from just an inquiry into what has happened and what went wrong and what needs to be fixed?
Well, absolutely, Viren. This particular serum was ready with the institute in Kasauli, where it is procured from. 70 to 80% of the demand is what they cater to from various hospitals, in fact, and they have clearly said that it was ready with them for the last 15 days. Let me tell you, the renovation of the lab in Kasauli had finished in June and July this year, and a demand had also been raised by the North Municipal Hospital because during this year, from September onwards till October, we see a number of diphtheria cases that come into the national capital. However, this time there was a back and forth in procurement of these crucial antitoxin that is required to cure diphtheria, which did not happen in time. And now after, 14 children died and total count of 18 children died, now the medication has reached the national capital.
Yes,
However,
so no preparedness. That is one point which is very clear, knowing very well that this is the time of the year when diphtheria is common in the national capital, and of course early intervention is critical, and because of that a lot of deaths are occurring. It's highly unfortunate. Thanks for joining us, Milan, but do stay on with us.